Good morning, everyone. So I hope everyone's really excited. Yesterday was obviously a very interesting day. Today, we are going to be talking about environmental toxicities, confounding presentations in Lyme disease. Next slide, there we go. So I'm a naturopathic doctor. I practice here in Toronto with Dr. Tim Cook at Vivagen Life Sciences. And today I'm going to talk about a topic that's very close to my heart. I discovered naturopathic medicine 15 years ago with my own mold journey and chronic complex illness. So today we're going to talk about how environmental toxicities can profoundly confound the presentation and recovery of Lyme disease. We'll be going through a framework of an overloaded rain barrel, which will help to provide insights as to why chronic Lyme is chronic. And over the past few years, I've treated many patients with chronic Lyme, and I've realized that Lyme is really just Lyme. I also have no disclosures. Okay. So when we think about chronic Lyme, we often think infection. But what if infection is simply the final straw? What if the real issue is the terrain that allowed the infection to take hold and to persist? As Dr. Neil Nathan, father of chronic complex illness, if you're not familiar with him, I certainly would recommend familiarizing yourself. We can't heal the infection if we don't first address the terrain. And so when patients present with chronic complex symptoms, our reflex is to think Borrelia, sometimes Bartonella, Babesia. But clinically, we see so many patients who have done the antibiotics, the botanicals, the ozone, and they're still not well. And so what happens is we need to, when this happens, we need to step back and ask why their system was susceptible to begin with. And that's because the infection is rarely the full story and often the final straw in a system that's already overloaded. So instead of asking how to kill the bug, which is still important, I want to step back and ask why the individual's body can't clear the bug. And that's going to be the important paradigm shift from chasing microbes to restoring the terrain. Okay, so I want you to think about the body as a rain barrel, as I've made this diagram. Throughout our lives, we're exposed to a wide variety of stressors, environmental toxins, infections, heavy metals, emotional trauma, which most people are surprised by, poor sleep, and nutritional deficiencies. Each one of these adds a bit of water into the barrel. And so for a while, the body, with its detox pathways, antioxidant systems, can keep up. It can clear small amounts through the drain at the bottom through our liver, our kidney, our lymphatic systems, bowel movements, and sweat. But if the inflow exceeds the drainage capacity, the barrel begins to fill. And so genetic polymorphisms, which we'll talk about a lot today, like impairments in the GST genes or MTHFR and methylation genes or SOD2 pathways, might mean our genetic drainage capacities are naturally smaller. And then you add chronic infections, hormonal stresses, and trauma, and the spigot tightens even further. So eventually the barrel overflows, and that overflow is what we perceive as symptoms. So fatigue, brain fog, reactivity, anxiety, inflammation and pain. And when a new stressor like Lyme disease comes along, it's often the final straw that makes the barrel overflow. So in complex illness, we have to stop focusing solely on the drop of the bucket and start emptying the rest of the barrel. So in order to do so, we turn off the taps. So reduce the new exposures. I'm giving you a sneak peek of what we'll be talking about today. So the mold, the metals, the chemicals. We need to open the drain, so support the detoxification and elimination pathways, and then repair the barrel itself. So restoring mitochondrial function, nervous system, and cellular resilience. So these are the four key insults we'll be talking about today. First one being mold and mycotoxins, commonly found in homes and musty basements, often can be insidious, hiding behind walls after water damage or leaks that we're unaware of. Other sources that were less discussed are cars and offices and air conditioning units, places that you are constantly in. I've had a number of patients who it's their office rather than their home as the insult. Heavy metals, so we know amalgam fillings and high fish intake, lead, paint, water contamination, and cookware as well. A lot of ceramics are finished with lead or contain. Trauma is one that is really important, and we'll touch on that. So chronic stress and then generally traumatic events, whether big or little t traumas, and chemicals. So PFAS, glyphosate, PCBs. Dr. Jacobson had a great slide yesterday on his presentation with TILT on all of the various chemicals there. So mold. Mold being one of the biggest confounding factors I see in Lyme disease. We breathe in mold spores. It can be rather insidious in where they're hiding, sometimes obvious, other times not. And we breathe in those spores into our nasal passages, and it sets up shop in our nasal passages and our digestive tract, and then we become the moldy building. And so the mold then secretes mycotoxins, and mycotoxins are the chemicals that the mold produces, and they suppress the innate immune system, they can activate mast cells, and impair the mitochondria. And so the result is the immune system gets distracted, fighting the environmental signal rather than the infections. And that's often why a lot of Lyme patients in chronic complex illness can't regulate. They're stuck in this inflammatory mode. So there's many different types of mycotoxins, and we have a whole talk on mold dedicated today. Some are more neurotoxic, some more hepatotoxic, some nephrotoxic, all generally immunotoxic. Dr. Cook spoke about one yesterday that is actually packaged in a drug for transplant patients. It's that immunosuppressive from the penicillium mold. And so now imagine somebody chronically inhaling small amounts of that every day. Oftentimes it's really tricky to determine mold versus Lyme. Their symptoms can be very similar. You know, we see fatigue and brain fog in both. Neuropathy, although, and joint pain and stiffness, they can present differently. You know, some migratory in mold, maybe less so, but dysautonomia, anxiety, insomnia. And so it's not about deciding whether somebody has Lyme or mold, it's often both, understanding which one is driving the system to determine where to start treatment. And so I find when we treat Lyme, first, sometimes in somebody with ongoing mold exposure, they often crash. But when we start by treating and removing the mold exposure, supporting their detox pathways, they often start improving, and sometimes dramatically even before antimicrobials. So a couple of clinical clues for mold toxicity. I touched on a few already. So brain fog, cognitive challenges in general, so difficulty word finding and poor short-term memory. Sinus congestion and chronic postnasal drip is definitely a keynote I see quite frequently. Sensitivity to light, sound, scent, especially with perfumes, cleaning products. Worsening in certain environments. So somebody's saying, oh, I feel so much worse when I go to the office, or so much worse when I go to my cottage. Or feeling better outdoors. Some people have a difficult time in the spring, I will admit, when everything is defrosting. And then exercise intolerance or post-exertional malaise. This one I see quite commonly. So patients will take anywhere from 1 to 7 days to recover after doing the laundry or something that's just pushing them a little further than they're typically able to. And then paradoxical reactions to detox or antimicrobials. So you may give them something that you think should be beneficial, and they react in a completely opposite way, and that we do see quite commonly. Testing options, we can do urine mycotoxin testing. We spoke about a couple yesterday that can be very beneficial. We can also do the visual contrast sensitivity test. It's an online, quick and easy test. Those with biotoxin burden often lose sensitivity to specific frequency ranges visually, and so we can see a deficit pattern on testing. And then we also have some imperfect testing, but it can be helpful. The ERMI and HERTSMI testing, they're essentially dust testing samples for various types of mold species. HERTSMI is 5 or 6 mold species that are highly correlated with biotoxin illness. whereas her ERMI is 26, I believe, different mold species. And then the clinical pearl here with testing is that if you get a negative test back, that doesn't mean that there's no exposure. It's happened multiple times where we have a patient who is very characteristic for Lyme, and we even know that there may be some exposure. So we're looking to see what that burden looks like, and they come back with clear or very low results, and that's often because they have poor elimination pathways. So we provide very clear instructions prior to doing the urine challenge testing or urine output testing, sauna therapy or bath the night before, glutathione for some days leading up to it to just really help to ensure that the body is actually able to be excreting. And oftentimes on repeat testing in 3 to 9 months, we actually see a rise, and that's just because we've really helped to open these detox pathways so the body is able to actually start flushing it out. Okay. Heavy metals, another one of our rain barrel insults. Most commonly, I see mercury and lead, and so mercury, of course, dental amalgam fillings, high fish intake, fluorescent light bulbs, and then lead in old homes, pipes, ceramic glazes, as I mentioned, and then also some personal care products and cosmetics. And so these are not just inert elements sitting in the body, they actually interfere with our core biochemistry. And so they cause mitochondrial disruption. Mercury and arsenic can inhibit complex 1 and 3 in our mitochondria, really impairing with our energy production. We see immune modulation with lead, mercury, and aluminum, which skew the immune system towards more of a Th2 dominant, more allergic inflammatory pattern, and suppress a Th1, which is one that we really need to fight these intracellular infections like Borrelia. Enzymatic inhibition, so metals compete for binding sites on our enzymes that where our mineral cofactors go, so zinc, selenium, molybdenum, and so those are obviously really important for pushing more of our detox machinery. And then biofilm promotion. A lot of metals like mercury and iron can actually stabilize these microbial biofilms and make them more antibiotic and immune resistant. And so symptoms, again, they're all quite similar. We do see some brain fog, of course, some paresthesias, that's a little bit more common, tinnitus, insomnia, metallic test. Testing, we can test red blood cells, and so we can test lead and mercury in the red blood cell, which is preferred to just serum testing of these metals because these metals hang out in the body. Although the red blood cells are testing for weeks to months exposure, whereas provoked urine testing, so that's when we do a urine sample kit, in a urine sample in the morning, and then we give them a challenge like DMSA to pull these metals out of the tissue. We wait about 6 hours, collect the urine over this period of time, and see what the body starts to release to see what the total body burden may be like. That is my preferred way of testing. We can also do hair mineral analysis. I know many practitioners like that. I don't personally use it, but I know that can be a longer exposure history. And then we can also just talk to patients about dental clues about their exposures. And then, of course, genomics, too. I don't have that up on there, but genomics and difficulty detoxing, that's going to be an overarching theme of everything. So the COMP gene, the GST genes, the SOD2 polymorphisms. Okay. So then chemical toxicities. So these are more of an invisible burden. Unlike molds and metals, which often have more clear exposure histories, chemical toxicities are more insidious because they come from the world we live in every day. Plastics, fragrances, pesticides, the receipts that we're touching, the furniture that we're sleeping on, personal care products, and even the air that we breathe and the water that we drink. Again, referencing Dr. Jacobson's tilt slide yesterday, lots of different exposures there. And the average person carries hundreds of synthetic chemical compounds in their blood. There's studies to suggest newborn cord blood actually contains over 200 identifiable toxins. And the tricky part is that these exposures are rarely acute. They're chronic, they're low grade, they're multi-chemical, they're synergistic, and this makes them harder to detect and far more disruptive to the immune regulation and detoxification. So these toxins can overload our phase 1 and 2, and so they can push phase 1 enzymes faster than phase 2 can actually keep up with, leading to more intermediates that patients can feel worse with. A lot of them are endocrine disruptors as well, so they're blocking or mimicking receptor sites, altering estrogen, thyroid, cortisol signaling, which is huge in patients with hormonal dysregulation and fatigue, especially in our women, our female population with menstrual irregularities. We see a lot of PMDD, and so having excessive hormonal disruption is obviously going to be further exacerbating. Mitochondrial damage, we see pesticides, solvents, and glyphosate can impair ATP synthesis and increase reactive oxygen species. And you'll often see more fatigue, chemical sensitivity, poor exercise intolerance. And neuroinflammation and limbic system activation. Fragrances and volatile organic compounds can directly activate the amygdala and limbic circuits, leading to more anxiety, dizziness, environmental panic responses. So symptoms here, I listed a few already. Patients with chemical intolerance are usually the canaries in the coal mine. They often feel worse when they're in certain stores, when they're in Ubers with fragrance, nail salons, exhaust fumes, etc. And so symptoms we see are headaches, dizziness, nausea, new or worsening chemical sensitivities or EMF sensitivities, fatigue again, skin rashes and flushing with or without clear triggers, and then reactions to the new furniture. So those who cannot tolerate IKEA furniture in their home, probably a good reason, but they tell us a lot. So testing of a variety of different ways, typically urinary environmental chemical panels, can see many different types of toxins, and again, it's the accumulation, not necessarily just one toxin in and of itself, and then genetic vulnerabilities, the same CYP genes, GST genes, etc. When it comes to chemical detox, the first step is always going to be avoidance and reduction. So identifying and removing the exposures, a fragrance-free home, we need to get rid of these scented candles and the air fresheners, organic cleaning products, getting rid of dryer sheets, stainless steel or glass cookware, and using air purifiers and water filters. When patients develop chemical sensitivities, the reaction is not just in their head. It's often a neuroimmune phenomenon activated by mast cells and the limbic system sensitization. And so they alter the body's perception of safety, keeping the nervous system in fight or flight. And so the chemical exposure activates the mast cell and the microglia in a sensitized individual. This triggers a release of histamine, leukotrienes, prostaglandins, cytokines, and results in that neuroinflammatory response, which we see in many of these symptoms, especially the top line there. And repeated exposure just keeps this the body in this chronic cell danger response, and the immune system alert, shifting away from that repair and detox and towards defense. And so over time, this chronic low-grade inflammation impairs the mitochondrial function, detox enzymes, and also the tight junction integrity, both of the gut and our blood-brain barrier. Finally, I wanted to talk about the nervous system. So the nervous system is the gatekeeper of healing. Again, another Neil Nathan quote. One of the most overlooked toxicities, whether we talk about, or when we talk about toxin load, we often think about external or physical insults, like chemicals and molds, but stress and chronic stress is just as potent. So trauma, whether acute, developmental, or chronic, changes the physiology of the terrain. It keeps the nervous system locked into defense mode, and when that happens, the body's capacity to detox and regulate inflammation shuts down. So of the clinicians in the room, how commonly do you see a never well since story begin with a major stressor? Absolutely. So trauma as a toxin. In this state, we see that blood flow is shunted away from the liver, the gut, and the kidney. Bile flow stagnates, bowel motility slows, detoxification stalls. the vagus nerve becomes underactive, and the patient becomes stuck in this biochemical congestion. So with that said, detox interventions won't alone work until the nervous system feels safe again. So I highly encourage you to read the Sensitive Patient's Healing Guide. That's Neil Nathan's most recent book. The first 100 pages or so highlight the importance and the governance of the nervous system on our body and our detoxification systems and our ability to heal. The limbic system, in particular, the amygdala and hippocampus, stores memory of threat in trauma. This loop becomes hypersensitive. So even minor triggers like a scent will be perceived as a significant danger. And so that limbic system activation is typically seen in that multiple chemical sensitivity, the EMF reactivity, exaggerated detoxification reactions. And patients often describe being stuck in a reactive body. And this reinforces the loop, low-grade stress signal, inflammation, impaired detox, more sensitivity, more stress. So what to do about it? Often we go straight to antimicrobials. So botanicals, antibiotics, biofilm protocols before the body is ready. When the terrain isn't stable, these treatments can really backfire. So I like to think of this as a terrain-first model, as sequencing and timing is everything. So first, we regulate the nervous system. So we just discussed the difficulties of when patients are stuck in that fight or flight mode. Detox and immune pathways simply won't function optimally. So before we do anything, we have to help the body feel safe enough to heal. And this can include breathing practices, limbic retraining, EMDR, somatic work, gentle movement, meditation, and sleep optimization. We've also largely lost our ability to manage stress. We move less, we connect less, we scroll a lot more. And with this population, they often don't have the energy to exercise or do a lot of those things. So we need interventions to support them and their body being able to calm down. So I love limbic system retraining programs. There's also, which there's a variety of, there's a new therapy that I'm using a little bit more frequently because it's very accessible. It's a process called journal speak. Very simply, you journal for 20 minutes daily. And it's all about not how your day was, but the true things that are rattling around in your brain or the past traumas. Whether you're crying, you're laughing, you're swearing, it's getting it out of the body, burning it, ripping it up, throwing it in the garbage, and then moving on. And this way we're having this constant process of getting these emotions out of the body, these stuck traumas. We also need to identify and remove the environmental toxins. So we look for ongoing environmental insults that may be perpetuating the illness. So these are things that continue to fill that rain barrel. So the molds, the heavy metals, the chemical exposures. If we don't stop what's coming in, we're just bailing water out of a sinking ship. So clinically, this means a detailed environmental history of home, of workplace, of water, of food sources, of personal care products. The goal here is lessening the total body burden so we can direct resources towards healing. We also need to support drainage and elimination. So this is the foundation. Before you detox or kill anything, we need to open up the exits. Think bowel movements, urine output, bile flow, lymph, and sweat. It is amazing how many people are constipated. And so we really need to think about cleaning the drains before we turn on the faucet. And if your patient isn't having regular bowel movements or if they're not sweating, anything you mobilize can recirculate and actually make them feel worse. So this phase focuses on flow, supporting hydration, magnesium and minerals, bile movers like bitters or phosphatidylcholine, castor oil packs, and then gentle sweating through sauna or movement. Then we move on to supporting detox and supporting the mitochondria. So detoxification relies on energy relies on mitochondria, so we like to do these synergistically. So repleting nutrients, antioxidants, and cofactors for both detox and ATP production. Think about B vitamins and methylation, glutathione pathways, NAC, vitamin C, glycine, sulfur conjugation, and then the mitochondrial supports like CoQ10, PQQ, carnitine, phospholipids, and minerals. And then once we've done all of that, we've stabilized the terrain and we're ready to address the infections. And so now we can bring in the Lyme and the co-infection specific therapies, antimicrobials, antibiotics, immune modulators, and IV therapies. And the best part is often these treatments start to work better because the patient who previously couldn't tolerate the antimicrobials or they herxed for weeks suddenly start improving. And we've shifted the terrain from survival mode into a healing mode. And that's when we can safely go after these infections and destabilize the system. I've talked a little bit about the genomic pathways, and Dr. Cook will be going into great detail on them. I just wanted to highlight a handful of the top ones I'm looking at, although this is a short list when we're assessing these detox pathways. So the GST genes, so glutathione S-transferase genes, GST M1 and T1, often it's not that they're suboptimal, it's often that they're deleted and the patient actually doesn't even possess them. So obviously there's a lot of poor glutathione conjugation and really supporting them optimally there. We can see a lot of nuances with the various, whether they have them or not, or they're suboptimal or not, and so we can provide specific actions on glutathione, sulforaphane, or NAC, depending on their variants. SOD2 is really important as a suboptimal SOD2 will increase the oxidative stress. We don't have that capacity to turn off the oxidation. Methylation markers like MTHFR, MTRR, SHMT1, and COMT, all really important and often involved in a detox bottleneck. We also have the CYP genes and NRF2, which can impair phase 1 and antioxidant signaling. And then I really like to pay attention to the PEMT gene as well. That's involved with how our body is producing and utilizing phosphatidylcholine. And I commonly see deficiencies in the PEMT gene or suboptimal genetic variants in my mold patients. And so really supporting them with phosphatidylcholine can be quite helpful there. So what to do about all of it? There's some overarching treatments. I know we're going to get into a lot of these topics in more minutia. So I just wanted to touch on some therapies that most patients could benefit from. So starting with sauna therapy, one of the most effective tools for enhancing elimination of fat-soluble toxins. Sauna therapy increases our core temperature and promotes sweating. Our skin is our largest detox organ. And so sweating helps to remove the mycotoxins, the heavy metals, the volatile organic compounds, and it induces heat shock proteins, which support mitochondrial repair, immune resilience, as well as activating the parasympathetic tone post-sweat, improving vagal balance. Colonics. I am a big fan of colonics. Colonics, again, if the exit routes are blocked, toxins recirculate. And so the bowels are the final step of detoxification. Colonics help to remove bile-bound toxins like mold, metabolites, and conjugated metals out of the system. And so not only are we draining the pipes, but we're also stimulating the gallbladder to do a massive release of bile. And that's often where that recirculation occurs. Mold is very smart, and it likes to live in the bile and kind of go on this enterohepatic merry-go-round. And so this kind of stops it in its place. And then I also commonly find this rapidly helps with increasing patients' response. There was a patient who was keeping track of her good days and bad days on a calendar by coloring them morning, afternoon, and evening. And so red was a bad day, yellow was regular, and then green were good days. And so we were going over, and she had months of red days, and just all the way through the calendar. And we started introducing the colonics, and we started noticing a trend. Her green days or green half days were related to her colonics, and really just helping move things through. She had a significant mold burden, and slowly we started seeing a lot more green. Instead of just a green morning, it was a green day and then a green week. So that can be really helpful. Glutathione and binder therapy. Glutathione is the body's master antioxidant and detox molecule, so really important in neutralizing these reactive intermediates from all categories of toxins. And restoring it, of course, is essential. Coupling it with binders, so binders like charcoal, clay, chlorella, physically capture and remove the toxins from the GI tract, so they're kind of like this catch-carry system. So the glutathione is pushing them out, the binders are helping actually capture them and escort them out of the body. Ozone, another one that it's a high efficiency detox and mitochondrial therapy. So it oxidizes biotoxins, disrupts microbial biofilms, and increases oxygen delivery to the tissues. It can also upregulate NRF2 and boost glutathione. And so clinically, patients often report improved clarity, energy, and decreased inflammatory pain. Red light therapy targets mitochondria specifically. So by stimulating cytochrome C oxidase, red light restores ATP production, reduces oxidative stress, and improves tissue oxygenation. Particularly helpful for that post-infectious neuroinflammation from mold and metals, and even trauma recovery, as it can normalize brain metabolism. It helps modulate microglial activation and also upregulates BDNF. Dietary fiber, this is the least sexy, maybe the colonics are the least sexy, but dietary fiber is the least exciting typically of them all, but it's an unsung hero of detox. It binds to bile, it supports microbiome balance, and it helps keep those exit routes clear. So it captures the mycotoxins and estrogen and heavy metals, especially in the context of low motility or dysbiosis. And so those prebiotic fibers also nourish the microbiome, which in turn regulates the anti-inflammatory support, short-chain fatty acids, and neurotransmitter balance, and so often in overlap with that limbic system dysfunction. And then finally, PPC stands for phosphatidylcholine IV therapy. Phosphatidylcholine helps to, it's essentially what our cell membranes are made up of, and it helps to repair and stabilize those cell membranes that are damaged by oxidative stress and toxic insults. It's like repairing the walls of the cell, allowing for better nutrient exchange, better detox, better signaling. And in chronic complex illness, membranes become really rigid and even leaky. And so the phosphatidylcholine helps to repair the fluidity of those cells and support the mitochondrial membrane as well. It also helps aid in bile formation, and so just adding to that detox pathway. Clinically, one of the best ways that I have seen to restore cognitive clarity and reduce neuroinflammation, especially those who have experienced concussions or any sort of insult to their blood-brain barrier. All right, so key takeaways. Mold, metals, and modern toxins can confound Lyme presentations. The immune system cannot recover in a toxic, inflamed, or unsafe body, and the path to recovery often starts with draining the barrel, not necessarily chasing that last drop. And I've provided a list of resources. These are some of my favorite books and websites. I've listed a couple of these already. The journal speak I was talking about comes from Mind Your Body, that last book there. And then the Toxic and Sensitive Patients Healing Guide. They go over many more environmental insults, like EMFs we briefly mentioned yesterday, sulfur sensitivities, etc. So I highly encourage you to check those out. And then any questions?